Okay, let's start. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Uh, Welcome to my presentation video. In this video, I will presentate to explain my research, which is discussed about where is it? The FISIPOL. There's comparison between FISIPOL and FKIK students' attitude towards the health protocol during this COVID-19 pandemic, which will be discussed in several aspects. And there's some parts which is first of all is the analytical research, and then the the results, and then the discussion. There's also a discussion in this video, and the last thing is the conclusion, of course. Okay. First of all, FISIPOL and FKIK is a super very different faculty, like 180 degrees, like so different. In FISIPOL we study politics, economy, and other stuff, but mostly in government thing, in international relations, communication, and the one last thing I forgot. And FKIK mostly is studying, as we know, they study health, which is they must they must have know more than us, the FISIPOL students. But yeah, we can see that, as we can see, yeah, there's so many difference between these two very different majors of studies. And because of this COVID-19 pandemic is very hard for us, especially for us as a student, and everyone, like our parents and teachers, lecturers. It's a very hard time because this virus, this pandemic, it's like terroring us every single day, every single hour in our daily life, which is not very good for us, and it will be a big threat if we get the virus and spreading to maybe our family, or maybe our closest friend. Okay, in this research, there are some aspects that I want to explain first, which is the college activity aspects and the organization aspects. The reason why is mostly on these two activities is very crucial and very common for the university student activities, mostly in UMY, University Muhammadiyah Jogja University. Uh, the college activity is which is very crucial and important. But the outside of this college activity, there is some students that most of the students like to join some organizations and do some discussion, or maybe do some action in the field, maybe without the support of this without the support of the campus, maybe. Okay, there's some data that I want to share. First of all, in the aspects of the uh, college activity between the FISIPOL and the FKIK. If we look at the left, there's a super difference, because 60%, there's most of the students from even from FKIK or FISIPOL is very need or very they most do the college activity in the online section than the offline. But also there's some students that do always offline in the class on always online, because there's a difference between decision of the lecture. And then there's also the decision the lecture doing the always offline, or sometimes there's more offline activities than the online. Okay, the next one is the organization aspects, which is like more the students have more time in the organization activities, like discussion, this discussion in cafe or maybe in other place until uh, until midnight. As we can see, the calculation of the students that do organization, the total is 30. There's 30 students in this research. 15 FKIK, 15 FISIPOL, but there is 4 in total university student that didn't join any organization. So I count that as a 26. As we can see, most of the students do the organization activity mostly do in online. As we can see, both FKIK and FISIPOL do 60% more. Online activity is more. They do more online activities than the offline activities because the threat of this virus. But there's also some organization that do always online activity, but there's also always offline for some reason. Okay. The COVID-19 pandemic requires us to do the health protocol, which is there's a lot. First of all, is like washing hands, with the soap, or maybe using the hand sanitizer, avoiding crowd, as we can see, and then using mask, which is essential for now, social distancing, and like there's a lot more, like avoid handshaking. In this research, we'll first of all we will discuss about how the FISIPOL and FKIK students do the using of mask. As we can see on the right, on my right, this one, uh, it says that there's more of FKIK students that do the health protocol of using mask than the FISIPOL. But the most of the students from FKIK and FISIPOL do this this type of health protocol using mask. But there's also some students that didn't, like, always do the using mask, but didn't consistent. But we can see on the far right, the yellow one, it says that the calculation is not far different because there's seven people, there's seven respondents. Sorry, there's 8 respondents in the FKIK, in the FISIPOL. That says that they're consistent, but seven respondents says that they consistent, and the difference is not really that far. So I think that the in this aspect, the environment of the students, which is that we know that the what is it the environment of the students is their friend in the faculty. Mostly there's a person that consistent, but there's also didn't consistent. So I think it's a bit equal in the implementation. Okay, next is the washing hands, hand washing. As we can see, uh, there's a big gap which is the FKIK is more disciplined, which is 14 people, 14 respondents in the chart. It says that FKIK student is more consistent than the FISIPOL, which is like 10 respondents that said that this one there's a lot 14 14 for FKIK 14%, and then 10% 10% that says that always consistent. But if we see the environment aspect of this in this two faculty students, we can see that from the FISIPOL aspects, the FISIPOL environment, there is quite a gap, because there's more people in the environment of the correspondent says that they didn't use a mask, which is quite dangerous for the surrounding people, the surrounding of the students, even for the student itself. And then the FKIK, it says that the environment of in the FKIK is more disciplined than the FISIPOL. Even there is there's a one respondent that said they in their environment they didn't even never using a mask. Okay, next one, which is the social distancing aspects. Okay, there is a big difference of implementation in the health protocol implementation in the FISIPOL and FKIK. As we can see, uh, in FKIK, there is a lot, which is four people difference. 10% that answered that there's not they do the social distancing sometimes and not consistent, which means that sometimes they do social distancing, then instead of always do the social distancing, uh, and the FISIPOL also the same, which is a very dangerous, because it will be like boosting the spread of the virus by like too close to other people that we even didn't know if they are they are healthy, or they got the virus, that will never know until the symptoms shows up. Okay, even there's in FISIPOL environment, there is like there's small um, number that says that they even never do the social distancing. But we can see, and we can do some little bit of excitement, which is it says that there is a lot of students in FKIK and FISIPOL that didn't do the social distancing in like they didn't consistent by doing this one health protocol. Okay, in this discussion we can see that in the aspects of hand washing, washing hands, the FKIK is more disciplined. The FKIK is more disciplined than the FISIPOL. Okay, and then using mask, as we can see in the chart above. Sorry. The chart above, this one, it says that there's more the FISIPOL and the FKIK student is always like using mask, but there's a small number of students that says that they didn't consistent do or even wear a mask when this activity, which is like the college and the organization activity began since the beginning. They didn't consistent by using mask, and the environment also is not really different, as we can see. The difference is only one. There's only one number. There's only one number percent a difference, but I should say that the difference is not really big, because the difference is only one. And the last thing is the social distancing, which is surprising me, which it says that the number of the students from even from FKIK and FISIPOL, there is a lot that didn't implement this social distancing, which they said in the questionnaire, that they said that the place that in the meeting is too small, or maybe like they too rush, even they like to enjoy the chit chat, so they didn't remember to implement this social distancing. So it's quite hard to imagine, even the FKIK that knows the health protocol, they know about probably know about this virus more than we from the physical student. Like there's more like didn't consistent, but also from the physical as well, they didn't there's still a lot, but 8% says that they didn't consistent, they didn't do consistently by implementing the health protocol. And even the environment, there is like they didn't do like never do the social distancing. Okay, and the and the answer of this discussion, which is there is even though the FKIK is really good, or maybe like I should say that the FKIK is more disciplined in like hand washing health protocol, but there is a big lack of consistency in the practice of health protocol in the environment of FISIPOL and the FKIK students. Okay, in the conclusion, I think FKIK and FISIPOL, yeah, they're different majors and different studies, but the implementation of this health protocol is super crucial of the spreading of COVID-19 among these two big majors, FKIK and FISIPOL, because if the if there's a person in this major that didn't care about the environment much, like they do whatever they want, they didn't use a mask, they didn't implement washing hands, or maybe using hand sanitizer, or maybe they didn't do the social distancing, and they will be I should say make a danger among their environment, like their family, or maybe their neighbors. So the conclusion is the FKIK is more good that in the implementation of protocol, which is the using a mask and the hand washing, but there about the aspects of social distancing, there is a lack of consistency because those reasons, like small places or and other stuff. That's all from me. Thank you very much for watching this video. I know it's quite long, but thank you for watching. Wassalamualaikum warahmatullahi wabarakatuh.